clearly, Houston, we've got a problem. And it would behoove, I think, the pharmaceutical industry to be stepping up with some constructive ideas on how they can play an active role and be helpful in making sure that all of our patients have access to affordable yet quality, effective drugs in their lives. And I think that's the goal. But I think all of us here on the dais, too, would agree that we're dealing with an industry that does take considerable risk. I think, Ms. Kopczynski, there are certainly nuggets of truth to what Dr. Holtz-Eakin testified to, that they invest money, they take the risk, there's a lot of failures, they are entitled to a decent return on investment on the drugs that they do hit on, and yet trying to strike that right balance, I think, is really the challenge that this committee has to wrestle. We don't want to stifle the innovation, but we also don't want to see excessive profit-taking, too, where it's not necessary. Is there any further guidance that you can provide us on how we can strike that right balance between encouraging the risk and the R&D that needs to go into it and the failures versus the high prices that our constituents are facing?
I think the most important thing is to specify, for example, in Part D negotiating authority, that you want to pay well for drugs that perform well, right? That you want to provide a good return on investment for companies, and that you want companies to be incentivized to provide drugs that really provide value to the American public, right? And part of what is so beneficial about that is, as others have mentioned, right now the system that we have encourages pharma to tweak old drugs and to do a lot of innovation that doesn't actually provide a lot of value to patients. And so what we want is a system that provides more value when companies provide more value.
Where are we on that? I mean, obviously, under the Affordable Care Act, we're trying to drive to value, to quality, the outcomes, and pay accordingly. How are we doing on that front when it comes to the drugs, the prescription drugs that patients are using? Are we developing good quality measures to know what are valuable and effective drugs and which ones aren't?
Well, I think part of the problem, for example, under Medicare Part D is that we don't have a negotiating authority that can really look consistently at that problem across drugs. And so to some degree, the PBMs are thinking about those issues, but not in a systematic way, in a way that I think really is what we need.
Yeah. Dr. Holtz-Eakin, welcome back. I mean, you've made so many appearances before our committee right now. You're probably entitled to a free coffee mug or something, but welcome back. But let me ask you something, because the Government Accountability Office just conducted this study back in 2017 in which they found, and I quote, between 2013 and 2017, the 5 largest U.S.-based drug companies spent 70% more on marketing and administrative costs than on R&D. Furthermore, between 2006 and 2015, the 25 largest pharmaceutical companies experienced average sale revenues increased by $241 billion, while only increasing their R&D budget by roughly $7 billion. Is there any reason to dispute these figures?
Not that I know of, no.
Ms. Kopczynski, back to you again. Is that a problem, that there's so much going into marketing and advertising and, versus R&D?
I think it's very clearly a sign of a problem, right? What we want is we want companies focusing their energy on real breakthrough innovations. And the system that we have now isn't really adequately encouraging that, and I think that's something that can really be addressed as part of this process.
Yeah. Ms. Spellman, let me ask you, because you mentioned in your testimony the problem with the extension of patent protection. But do we also need to be looking at the secondary patent system as far as things that need to be cleaned up and corrected so it's not so easy for these patents to be extended unjustifiably or unnecessarily?
Absolutely. We want innovation. We want drug companies to go back to the bench, and we want to give them a good reward when they invent something. That's what we're trying to drive in this system. The secondary patents we have now are absolutely distorting the incentives, and they're distorting the innovation we're getting.
Mrs. Sassi, let me quickly ask you. I'm astounded by talking to doctors who claim that their patients walk into their office demanding a brand name drug because of a commercial they just saw on TV. I wouldn't feel confident doing that, because what do I know about what drugs I need in that? But yet it seems to be a powerful influence in how drugs are being prescribed. Would you agree that there's a problem as far as patients driving the demand for these drugs, especially the brand name and the cost that they're paying?
Absolutely, and what we know is the U.S. is one of the few countries that allows that kind of direct-to-consumer advertising for this very reason. What we should let is medical science determine what's the right drug for that patient. And it's a really serious problem that, that patients are being advertised to, and also they don't understand the cost associated with the drug. And so one proposal that the administration has made is to force manufacturers to actually put that price in the advertisement. We support that. It's just one small step in the right direction.
Thank you. Thank you, Mr. Chairman.
Thank you, Mr.